Welcome to The Explainer. Today, we're breaking down a rare and really complex condition known as Eagle-Barrett Syndrome, or as it's more commonly known, prune belly syndrome. Okay, so here's our journey for today. We're going to start with the fundamentals, what exactly is this condition? Then we'll walk through how it's diagnosed, how it's treated, and finally, we'll look at the long-term outlook. All right, first up, let's get right to it. What is prune belly syndrome? What are we actually talking about here? Well, the condition is defined by something called a clinical triad. But what does that actually mean? It just means there are three specific features that almost always show up together. So let's break down this triad. First off, you've got poorly developed abdominal muscles. This is what gives the belly that wrinkled, prune-like appearance and the syndrome its name. Second, in boys, the testicles don't descend properly. They stay up in the abdomen. And third, there are some pretty major problems with the urinary system. The bladder is enlarged, and the ureters, which are the tubes that connect the kidneys to the bladder, don't drain urine the way they should. But it doesn't stop with that main triad. The syndrome can also lead to other significant challenges. We're talking about things like underdeveloped lungs, blockages in the urethra, and kidneys that haven't developed correctly. And because of all this, there can be a risk of infertility later on for boys, and even issues with basic things like sitting up or standing because of those weak core muscles. Okay, so let's move on. How in the world do doctors identify a condition that's this complex? And the first thing you have to understand is just how rare it is. Prune belly syndrome affects about 1 in every 40,000 infants, and it is overwhelmingly found in boys. One of the most difficult things is that we still don't know the exact cause. It's a real mystery. But because we've seen cases in siblings, scientists think there's probably some kind of genetic link at play. The process of figuring this out often starts before the baby is even born. It can get spotted during routine prenatal ultrasounds. Then, after birth, a whole series of additional, more detailed tests are used to confirm everything and really understand how severe the condition is. And after birth, doctors have this whole toolkit of specialized tests to get a complete picture. As you can see here, they use things like ultrasounds to check organ size, a VCUG to look for urine flowing the wrong way, a MAG-3 scan to really see how well the kidneys are working, and MRIs to get super detailed images of the entire urinary tract. So once that diagnosis is confirmed, what happens next? Well, as you can probably guess, treatment is a multi-stage process that really depends on how severe the condition is for each individual person. Now, this is the crucial point. All the treatments, no matter what they are aimed at tackling two huge challenges: supporting the lungs and making absolutely sure the kidneys can drain urine properly. In some cases, treatment can even begin before birth. There's a procedure called amnioinfusion, where fluid is added into the amniotic sac. It sounds complicated, but the goal is simple: give the baby's lungs a better environment to grow in. And right after birth, this slide shows the two main surgical options. Both are designed to create a temporary path for urine to get out of the body. One is called a vesicostostomy, and the other is a ureterostomy. The whole idea is to protect the kidneys from damage until more permanent repairs can be made later on. Yeah, and as a child gets older, other surgeries might be needed. These are to correct specific anatomical issues, like repairing and reconnecting the ureters, surgically moving the testicles down into the scrotum, or even reconstructing the abdominal wall to help with core strength and breathing. Okay, let's move into our final section and see how this all comes together for the long-term journey. So this is really the key takeaway for the future. The path forward is highly individual for each and every person with this condition. It's not a one-size-fits-all outlook. And that's because long-term care is so comprehensive. It often involves specialists to manage breathing and prevent infections. And in some cases, it might even mean preparing for an eventual kidney transplant down the road. It's a lifelong journey of management. And all of this leaves us with a final thought. With medical innovation moving so fast, you have to wonder, what new possibilities are on the horizon for managing rare and complex syndromes like prune belly? The future is constantly evolving,